everyone, welcome to MRCOG Part 2 Crash Course Orientation Session. July 2026 exam, only 80 days left. How does this topic seems to be? Only 80 days to Part 2 exam, July. What do you all say? Yes. Hello, Dr. Varsha. Hello, good evening. Okay, yes. So good to have you all here. Yes. Who else has joined? Let me know. Say hi in the live chat so that no, I know. Yes, I can see Dr. Varsha here. Who else is there? Keep chatting, right? That's what makes it interactive. That's it. So we are going to talk about, is it possible to pass exam in 80 days or not? So that is what the topic of today's strategy is, and that is what the crash course is meant about. So we are going to talk about that final leg, which we are going to do to achieve the final results, a successful result. And I would suggest that don't lose your July exam. It's a good exam. Okay. So do stay concentrated onto your July exam and keep preparing. Yes, Dr. Francis. Yes. Hello. Yes. Yeah, good to have you all. Good evening. Very good evening. Yeah. So let's start. Start today's session with this. Okay. So I know many of my enrolled students have also joined and they would love to solve some of the questions and not just listen to the strategy. So I'm starting my session with the questions. Yes, Dr. Beena. Hello. Good evening. Very good evening. So, yes. So now let's see who is going to answer the fastest finger first. As usual, as always, I'll announce the names of the ones who give the answer correct, right? So let's see. This will also tell you how well you are prepared because in our course, I probably see that our course students should answer is this correct. So let's see. So let me show you something. A primary gravida that is aged 32 years is seen at her booking visit at 8 weeks. Her medical history includes long-standing diagnosis of type 1 diabetes mellitus, which is spanning over the 20 years with established renal complications, including nephropathy and nephrotic syndrome. Her BMI is recorded as 28. Yeah. So, what is the most appropriate management? So, let's see. Type in the chat. I would be looking at the answers and I'm waiting. Yes, Dr. Ankati Majumdar. Hello, ma'am. Good evening. Yeah, good evening. Very good evening. And thank you so much for taking out time and joining in today. And I make sure that while you leave the session after 30-40 minutes, you are definitely benefited and you have a clear-cut strategy in your mind, like how to utilize your remaining days for the success, for ensuring your success for this exam. So what is the most appropriate management for this? Let's see who answers first. What is the most appropriate management here? Okay, so yes, do we need low molecular weight heparin? What is the score in this patient? And so according to score, what is the correct answer? That's what I'm waiting for. Yes. Yes, who is going to answer that? Because we have to choose the fastest finger first. So we need a correct answer, and it's a good opportunity to have the correct answer right at this time. Oh, so the answers start coming up. So let's look at this. Basically, this question is like she has a type 1 diabetes spanning over 20 years with renal complications, nephropathy, and nephrotic syndrome. So whenever patient has a nephropathy and nephrotic syndrome, definitely that is nephrotic range proteinuria is there. So she will definitely need the low molecular weight heparin in the antenatal period, right? So that is there. And whenever the patient takes the low molecular weight heparin in the antenatal period, there is a rule. She will always take it 6 weeks postpartum. So that is there. Now there are two options which state this, E and F. So out of E and F, which is the correct one? So out of E and F, there is a difference of aspirin. So what is the indication if I want to start aspirin here or not? So the indication is the type 1 diabetes. So that is, and chronic kidney disease, right? Chronic kidney disease, chronic renal disease. So that is an indication for use of aspirin. So what all has been tested here in the by the RCOG? They have tested you indications for the aspirin as well as the VT risk scoring. So two guidelines merged together, and that's what makes the RCOG tricky, but it is not tricky if you can see through the question and if you can go inside the brain of the RCOG examiner, and that's what we make you do. So that is why there are two guidelines here. NICE, hypertension in pregnancy, which talks about the aspirin. And there is another guideline which is included here is the VT risk scoring. So if I join these two, E is perfect answer. Antenatal aspirin plus prophylactic low molecular weight antenatally and 6 weeks postpartum. So that's absolutely the correct answer. And who is the fastest finger first? So Dr. Francis, she is the fastest finger first. But we have many correct answers like Dr. Beena and Dr. Ankati have also answered it correctly. Oh, there is further Dr. Shabnam, that is also the correct. Yeah, there is one confusion about the option A. Why option A is not the correct answer? Because that is talking about the therapeutic low molecular weight parent. Therapeutic is used when there is high risk factor or there is already existing clot. In this patient, there is no existing clot and there is no high risk factor like high risk thrombophilias. So we are going to use here only the prophylactic dosages. So E is the correct answer here. Very good. Very good participation. So much active participation. Awesome audience. So what next? 32-year-old woman in her first pregnancy attends the booking visit at 8 weeks. She has had type 1 diabetes since childhood. Her recent renal profile was urine PCR is 40 and serum albumin is 18, serum creatinine is 156 and peripheral edema is noted on examination. Her BMI is 28. What is the most appropriate management for this patient? What is the most appropriate management for this patient? Yes. Looking for the answers in the chat box. And let's see who takes the fastest finger first this time. So, yes. Keep answering. Yes, that's it. So here, what we are looking at, again, the patient with type 1 diabetes, but some of the investigations have been given to us, where the PCR is 420, serum albumin is 18, serum creatinine is 156, and peripheral edema is also noted in the patient. BMI is 28 only. So what is the correct answer here? So basically, again, yes, Dr. Ankati, yes, that's the correct answer. Now, she is the fastest finger first. That's a great opportunity to take today and be active, and anybody can do that, right? So, yes, this is the same question, but asked in a different way. They haven't given you exactly that this is a nephrotic range proteinuria. In the previous question, it was clearly mentioned that this is a nephrotic range proteinuria. So you were very clear because you have seen that word in the VT risk scoring and you exactly know that, yes, this is the thing. But in our cases, in exam, they will twist this. Now, how do they twist this? The same thing is being asked, but here they have given you the investigations instead of just writing one word that this is a nephrotic syndrome. And that makes it trick. In exam, when you see the investigations, you may skip the nephrotic range, but you see that there is a significant proteinuria in this case. So again, the answer will be antenatal aspirin, prophylactic low molecular weight heparin, and 6 weeks postpartum. So E is the correct answer. Very good. There are other correct answers too. So that's very good. Now coming to the next question. That is 33-year-old woman attends her postnatal review 6 weeks following an emergency lower segment cesarean section performed at 34 weeks for HELLP syndrome. Her blood pressure at 2 days visit is 128 by 82 on labetalol 200 milligram twice daily. She has a long-standing history of seizure disorder managed with carbamazepine 400 milligram BD with her last seizure 18 months ago. Operative findings at cesarean noted a fundal uterine septum extending to the internal os with two distinct uterine cavities. She is currently breastfeeding and wishes to discuss reliable long-term contraception, exactly like the long scenario you have in your exams. So same kind of a scenario here for you to brainstorm. And this is what we make you do in our live sessions as well. Another thing is like when we talk about like recalls come in exam or not. What do you guys say? How many percentage of recalls? January 26 was different. Many of you would say. But actually, there were still 75% recalls because, as I just have shown you in the previous question, the questions will remain the same, the concepts will remain the same, but they will twist them. So, you need to understand those concepts, and that's what we are going to do in our crash course live sessions as well. So our crash course live sessions break through all the recalls in the live session where we will talk about all the important concepts which are repeatedly tested in exams. So going back to this question and waiting for the answer. Yes, I've started receiving the answer. Yes, I'm waiting for more options to come up here. Yes, so there are two options here. I can see E and C as of now. So now let's look at this question and analyze it. So first and foremost, this patient is 6 weeks pregnancy, right? 6 weeks pregnancy. So maybe COCP can be used after 6 weeks, but HELP syndrome is also there. So we will not go for that. Another important thing is patient is on carbamazepine. What is the importance of carbamazepine? It's an enzyme inducer. So any oral pills, something can be affected by the enzyme inducing drugs. So we are not choosing the oral compositions here. Then coming to the uterine septum. What happens with the uterine septum? It is dividing the uterus into two. So any intrauterine device cannot be used. Now, if I look back, then what I am left with? I cannot use copper IOD. I cannot use levonorgestrel. POPs will not be an option because enzyme inducer is there. COCPs cannot be used. Depo-metroxyprogesterone. Is it useful? Yes. This can be given because that's a parenteral progesterone, not affected by the metabolism. So we can use the not affected by health. Good to go in 6 weeks postpartum patient and no if not having any effect on that uterine anomaly. So E is the best option here. So this is how like if you can figure out like these, okay, these are the four chunks. I need to put them together. And then you put them together and get the right answer. So who has got the right fastest finger first? So that is Dr. Manisha Ghate. So that she has got the fastest finger first. So very good. So why C is not the correct answer? Progesterone only pill. So no progesterone only pill. And then there is another one which is I think G is the another option. But again, so progesterone only pill we are not using because of enzyme inducers. So G is also not the correct answer. So this way, if you learn to break up the EMQs like this, then it is very, very easy. Hello, Dr. Pooja. Yes. So coming to the next, right? Now, this question is kind of, you can say, the variation of the previous question. And let's look at this. 33-year-old woman attends her postnatal review 6 weeks following an emergency cesarean section performed at 34 weeks for HELP syndrome. Her blood pressure today is 128 by 82 on labetalol 200 milligram PT. She has a seizure disorder managed with levetiracetam 500 milligram PT. Last seizure is 18 months ago. Operative findings noted a fundal uterine septum extending to the internal os with two distinct uterine cavities. She is breastfeeding and wishes the reliable contraception for at least 3 years. What is the most appropriate contraception of choice now? So now, which is the most appropriate one here? Because now the drug has been changed. Levetiracetam is given, right? How does this makes a difference? How does this makes a difference? Oh, Dr. Beena Tandon says she answered first. Okay, sorry, Dr. Beena. So you got the fastest finger first. Great. And you got it again. So no way. If you missed the previous one, but you got this one right also. So the answer still remains the same. Still remains the same. Why? Although levetiracetam is not an enzyme inducer, and we can give this levetiracetam, with this, we can give the progesterone only pills. But again, read the question carefully. She wishes reliable contraception for at least 3 years. So levetiracetam, even if their POP is safe, but again, we cannot have a POP for 3 years. We can, but it is not good, right? Compliance is difficult. So therefore, again, the Depo-Provera wins the case in this case. So, yes, Dr. Beena Tandon. So she got the fastest finger first, and maybe this was the second time that she got it. So here's a applause. So both questions had same age, same health history, same BP on labetalol, same biconjugate uterus, same breastfeeding, and same 3-year contraception need. What changed? Carbamazepine versus levetiracetam, which will make you think immediately about the POPs, right? And that will actually make you think like whether to go for the POP or DMPA, or because both are also given in the option. So options are very close always in EMQ. Now you get stuck at 3 options. Choose the POP, choose the DMPA, or choose both together. And the both one like that brings in, okay, let me choose both because both can be given. But here the 3 years is the key. So you need to interpret these things. Now, this is not only the knowledge, this is the kind of strategy which you have to learn to come to the point where you can just enter into the examiner's brain. So answer DMPA in both cases. Biconjugate uterus rules out IUD, IUS breastfeeding help rules out COC, DMPA is injectable and works regardless of enzyme interaction. So what happened? The drug changed. You wanted to change the answer, but you should not have. And those who did not choose the another answer and they just stuck to that, they just did that. So it's not about only the knowledge, but you have to learn about the strategies. So very important that when we are going to the exam, why it is important to be in your best preparation? Because what failing actually costs you? It's huge. It's huge. And the mental trauma, as you see in the last line, emotional toll on you and your family, it's priceless. We are just taking out our precious time from our daily routine, from our daily life for this exam. So it should not go wrong. Exam fee is huge. You are putting so many days. Maybe your career application are delayed. So it is priceless. Better to go with a trusted, a streamlined process, which is less than half of the cost of one reattempt, and you can get through it in a very nice way. So, it is my fourth attempt, and without whom I would not have passed. I used to study 4 to 5 hours a day, practice question banks daily, but what lacked was the use mind knowledge, and this happens with, I think, most of you. It is not about reading more. Every day I get text. What else should I read, ma'am? Should I go for the talk articles? Should I go for this? What extra things? Should I go for any other question bank? See, you can go for n number of resources. You can go with n number of resources, but you need to be thorough with what you have. So having undergone so many coaching, so many different approaches, nothing did magic. So why? Why? Because it's not about guideline teaching. It is about knowing those strategies to apply your knowledge. So you cannot waste extensive time on the guidelines because every time when you go on to the questions, you get some questions wrong and that makes you go back to the guideline again. And so you keep going back to the guidelines. And as many times you go back to the guidelines, you are just shunting between the questions and the guidelines and you are not progressing. How to progress? You need to solve the questions, get their explanations, get those points just immersed into that, and that's how you can practice your questions. If you haven't started studying now, then today is the best day because we are having the live session, first live session today for the orientation, and or even for my enrolled students who have not yet, because some of you are also like telling that I could not follow, I had something on the other at my plate, I've not started. Shall I start now? This is a question I think every day in my chats I'm getting 10-15 questions like this, that shall I start now for the July exam? Yes, start now. Today is the best day to start for this. This is a real time which you can use. Now, this is the safe period because, see, if you go back and look, okay, students have studied so much. Can I study from now? Yes, because last 2.5 months, 3 months, that means the most. Nobody keeps on taking time for complete year. So if you are thinking now, you have filled your expression of interest, this is the time when you can start now here. Okay. Second thing is, uh, because like you feel overwhelmed by looking at like I've missed so many stations, but that is why we are starting afresh from here. So if you have not started till now, start following this schedule from here, and I will guide you today like how to utilize the course to the best possible in next 2.5 months to attain your success. Let's look at the another question. A 28-year-old woman presents to the early pregnancy unit at 6 plus 3 weeks of amenorrhea. Transvaginal ultrasound reveals a 22 millimeter adnexal mass with no fetal heartbeat and an empty uterine cavity. There is no free fluid in pouch and her serum beta HG is 2800. She is hemodynamically stable. Full blood count, RFT and LFT are within normal limits, and she reports mild lower abdominal discomfort, which is fully relieved by oral paracetamol. What is the most appropriate management at this point of time? Let's look at this. What is the answer? Yes. There's a question here. Can we give POPs and DMPA together? Why? Why would we give two things together? No. That's the option was like, can you can use either one of those, right? But actually no. So in this case, yes. So yes, there are about the E, B, B, A. Okay. Okay. Why A? Why we can do expectant management in this? Isn't it ectopic? Because you can see the clear adnexal mass in it. So it's an ectopic. So no expectant management here. Next option is admit for observation and repeat scan in 48 hours. Why admit for observation? There is nothing. Patient is stable. And what will happen in the repeat scan? Not. So ultimately, this is a ectopic and we have to choose the management. So to choose the management, can we give the methotrexate here? It fulfills all criteria. Adnexal mass is less than 35 mm, no fetal heartbeat is seen, and beta HCG is less than 5,000. But yes, the mild lower abdominal discomfort is there. So does it stops us from using the methotrexate? No. NICE guideline definitely says that no pain. Okay. But we have to go one level deeper. No pain means there should be not an impending rupture. So now mild lower discomfort which is relieved by oral paracetamol cannot be something which is impending rupture. So intramuscular methotrexate is still the correct answer. Now, can you get this just by reading the guideline? Just a quick question. Can you get this point just by reading the guideline? Can you make it correct just by reading the words of the guideline? I want to hear the answers in chat box. Yes or no? Yes. So fastest finger first for this particular question. Meanwhile, I am announcing the fastest finger here. So the fastest finger first for this question is again Dr. Beena Tandon, and she has done the hat trick. 3 questions, one after another. So has a round of applause. So yes. So that's it. Okay. So we can, even if we read guideline multiple times, this is difficult because no pain is written there. So you need to know the strategy only by answering those questions. When you solve those types of the questions, then it becomes very easy. Now, this is the same scenario with a bit of twist. Okay. So 28-year-old woman presents to the early pregnancy unit at 6+3 weeks of amenorrhea. Transvaginal ultrasound reveals a 22 adnexal mass with no fetal heartbeat and an empty uterine cavity. There is no free fluid in pouch. Her serum beta HCG is 2800. She is hemodynamically stable. Her full blood count and renal and liver function tests are within normal limits. She reports significant lower abdominal pain requiring regular tramadol and not adequately controlled with oral paracetamol. So now she requires using the tramadol. Now this is something serious, right? She has got severe pain, and so this could be sign of impending rupture. So now we need to go for what? We need to choose the surgery in that case. Although all other criteria are same, but just changing this one point made the difference. In the previous question, it was non-significant, and here it is the significant lower abdominal pain. So the laparoscopic self-injectomy will be your best answer here. That's perfect, right? So that's perfect. So this time Dr. Ankati Majumdar, she has got the fastest finger first and many other correct, right? Dr. Beena, Dr. Malika, Dr. Francis, everybody has done it, right? That's perfect. Perfect. So both questions had same age, same gestation, same 25 millimeter mass, same beta HCG 2800, same hemodynamical stability, same normal blood, same empty uterus. Mild pain, which is relieved by paracetamol, we can use the methotrexate. When it is significant pain requiring tramadol, we use the self-injectomy. The guideline says no significant pain. It does not say no pain at all. It's not about the words, it's about the meaning, one level deeper. This is what we train in the crash course. And this is what like our students can do. As you can see here, Dr. Manisha, Dr. Meena, Dr. Francis, they are already enrolled students and they could gather these tricks because they know these tricks, right? So that is how the correct. Dr. Ankati, they all are. Yeah, Dr. Swati, hello. So they all are enrolled students and they know the tricks, and that's how the students can crack. You should know that these tricks before you go to exam. Otherwise, it's going to be quite confusing at that time. Now, why does this question even comes to the mind? Like, is it possible in 2.5 months? So why it seems difficult to pass part 2 in 2.5 months? Because there's too much information flowing, and there is like, it is too much in the brain. Almost 180 plus guidelines without filtering what's tested. If you have those big PDFs in front of you, is it possible to read them all? Definitely, I will have the same question. Oh my God, can I do it in 2.5 months? Treating part 2 like a knowledge exam. It's not your knowledge. See, knowledge is a part of it. Definitely, you need to know the basics. But it is not only knowledge. You need to make the clinical decisions, and that's why you should be prepared for. Like, what is the reason behind it? What is the strategy behind it? What is the examiner thought behind it? That's what you have to look at. Being too safe is a problem. Second guessing is a problem. Being too much thoughtful, overthinking, big problem. Keep on changing the answers, very big problem. Because the more you are going to think, 3-4 options will seem like correct. And many of you who have already appeared in the exam must be facing this already. So study mode does not fix it. Studying differently does. Like people ask me, like, how many lectures, how many hours of PDFs, how many hours of this, how many questions. It's not about this. I can give you all the numbers, like how many videos, everything is covered. But to me, if you ask, I would love the course which is as short as possible and still giving me the thing to pass, making my probability highest to pass. Everybody wants to read small and pass the exam. So studying more does not fix us. Studying differently does. Another student, like one of you, same pattern. Having failed the first attempt by following other courses, I joined the MRCOG courses as my last option. Literally, students come to me like, this is my last attempt. If you can help me, I'll pass. Or if I not, I will have to leave this. And I'll tell you, one of the student, actually her life was stuck in this. How a life can be stuck in MRCOG Part 2 exam? Because her husband was well settled in the UK. So she had only 6 attempts to pass the MRCOG Part 2. And if she could not pass in that attempt, then she will not stay in the UK, at least for the career. Then she will either have to stay on the dependent visa. So after 5 times failing, she came. And in last 2 months, she could make that difference and she could get it. So her life was saved. Sometimes these things, which sometimes we see that, okay, let me just leave that, make it postponed, why it is important. But sometimes these things can be your life savers. So this is how, like, she teaches EMQs like a baby and taught how to walk. How do I teach you? Like, how can I tell you, like, to go for this? This is how. I will interpret everything. Like, when you know that exactly what RCOG loves to ask, and that's how you go further. Okay, yes. What actually changes the score? Not more content, not longer hours. I don't believe in longer. We believe in productivity. Whatever I am studying is should be productive. Better filtering, we remove 80% of what's not tested. Clear prioritization, what is to be read, highest yield topics, and controlled thinking. Make you learn how to think like an RCOG examiner. Trust your first instinct and stop overthinking. Now, this is the most important question. Like, student keeps on asking, like, what should I do? When they take our course, they have the videos, they have the PDF links, some online PDF links, and then there is a lot of questions on the website, right? So every time this is about how to practice this question, right? How to practice, how to go about the website content. So like they will ask, like, shall I watch the video and make the notes? So I say no, big no. Because what is this? You are just consuming. You are just consuming, that is your passive learning. You are just looking at the video and you are copying down from the video points. And then you keep those piles. Okay, I'll read this later. But that doesn't work. That is just an overwhelming pile for you, which will always make you scared. I have to revise those much. So it's not a good thing. So I don't believe in passive learning. I believe in active learning. What is active learning? When you recall something from your brain, and that's what I make you do every day. Now, when you are towards your exam, you have to start solving like 30 questions in a day. Those who are already solving 30 questions in a day, they should move on to 50 questions in a day. Those who are already solving 50 questions, I know many students in my course are already solving 50 questions in a day. They can move on to 70 questions in a day. In a week, move on to 100 questions in a day. This seems scary, you know. You think that on one side the ma'am says that just read 3 hours, and the other side she is saying that do 100 questions. But let me tell you, and many of my students who are already here in the session can actually be a witness to it, that when you start solving the questions first day, you will take time for 30 questions itself. But next 7 days, the time will decrease. You will be doing them faster because we are helping you prepare for a marathon which you are going to run at the end. So if you have to run a 10-kilometer marathon every day, you have to run. And that's what we make you do with the help of worksheets. And how to utilize those worksheets. When you are solving the question, you keep a paper pen along. When you are picking up any answer, please do write a point there. And every information about that in the pointers. Now what you are doing, you are recalling this from your brain. And because you are recalling and then writing, then your brain is exercising. And when you exercise, you retain. So brainstorming is going to help you retain. So stop just consuming. Just stop reading the PDFs, looking at the video and making the notes. This is nothing. This is just consuming. Start true learning. True learning is your own pointers which you are putting up along with the questions. So I believe in active learning, and that is the one thing which changes your exam preparation with us. Why our worksheets change everything? It's not just a simple question bank. They are smartly designed exam training system. They are simply designed exam training system. That is what, like, when students ask about, I've already joined one course. Shall I come to your course? Yes. If you have been studying theory from some other course, still you should come to this course, because you will not get the such type of worksheets designed for you. Even if you take those worksheets and you solve those worksheets within the course, then even that will give you the maximum benefit. It gives you exam like practice, right? Exam like practice, it exactly mirrors the same pattern. You are doing multiple questions in a row and then submit. Because many of the students, how they are doing the question practice, either they are solving questions in the Telegram groups, or they are provided with kind of a PDFs, or what they are doing, they'll see a question on the website, they'll solve it, submit, and see the answer. After every question, you are seeing the answer. So your brain is not doing the exercise which you will be doing in the exam. So it's same. If you have to run a marathon, you will run every day. And that's what we make you do here. So exam like practice. You walk into the exam already when you have solved those worksheets multiple times, you can solve them n number of times. Topic wise focus. We help you do the worksheets topic wise. Every topic, so that you know where you lag behind, and you master each and every EMQ topic. So every day when you work on one topic, that is going to replicate in your exam marks. Work in niches. Each worksheet targets a weak specific area. So you know that which area I'm good at and which area I need to work on. Performance tracking. You know that when I started reading, I was getting 50%, then got the 80%, then got the 100%. So you exactly know how to go forward. And this is how you know where you are actually losing marks and put your more time there. So it's totally evidence-based and data-driven preparation which you will be going through. Every passing day, you are taking time to think about, shall I do this, shall I do that? Enter into the course and take the decision. Booking day is yet 7 days ahead. And our first live session is today. So why not join today and see your performance in the next 1 week and then take the decision? Because in our full course, we have access till pass. So no issue. You have to think today, like, shall I go or shall I not? This all is possible even after entering the course. You enter into the water, see how well you can swim. Maybe you just take 1 day to swim better. And if you are swimming perfectly, why not go for the exam? Why leave this opportunity? Why delay another 6 months? You can get your MRCOG this year. So every passing day matters. And if you are already destined for the July exam, then every day is critical. Start today, 82% chance of passing. Another 2 weeks drops to 65%. Another 2 months, only 15%. So I don't think you will really want to delay this process. Our 3-hour plan is typically make you revise like this. So first we will give you the refined content, then you revise, will help you revise, and finally make you rejoice with the success. Today, 15th April, is the precious day when we are starting the phase. Now, all those who are going to start today, you just need to follow the schedule. You will have a schedule like which day for what thing, and just keep following the schedule, and that's what is totally done. All about theory, all about videos, all about PDF, everything at one place. You don't have to go and search here or there anything. Okay, just need to start. You take the website as a single book, start from first and complete till the end. Go again, go again, and go again 3 times. That's it. Nothing else is required from you. Ultra condensed video sessions with PDFs, live interactive sessions, they are recorded if you miss, and EMQ shots are already. For EMQ shots, I think everybody who is here will say yes. I don't think anybody can say that they are not benefited by that, right? That's a very beautiful, crisp 5 minutes videos for any particular exam topic. And that's how you can you can prepare for any EMQ topic in just 5 minutes. 5 minutes literally means 5 minutes. And see, if it is just a 5 minutes content, how many times you can revise it? So Telegram group plus direct faculty support throughout, you will get the person to answer your live questions, whatever questions you are putting in the group. Mock tests are included, and there is a specific session for January 2026 recalls. No guideline reading, we filter for you, and access is till the exam. So I think nothing else is required out of this. Anything else you think you need to pass the exam? No. Everything you need is here. So that is what is the bonus offer right now if you enroll now? EMQ workshop intensive practice is a part of your crash course if you start now. So why not start today? Start from the first session and be a part of this success program so that you are destined to pass and you are not losing anything else. Let's do the math. Without the crash course, exam fee is 90,000, risk of failing, reattempt another 6 months waiting. So 1,80,000 with total risk. With crash course, that is 7,999, huge pass rate, access till you pass, and it's the only investment. For those, again and again, I'm repeating, there are students who have not started reading in spite the course as well. So please start now. You just need to follow. That's it. Nothing else to think about. So do not let this come in your mind that is it possible? Is 90 days really enough? This is the first question which every time comes to your mind. So our 3-hour plan is built for 90 days. We have a plan for 90 days. If our students can do those in 90 days, why you cannot? Right? So you are also like the same students who have already passed. I am too busy. Maybe they were not busy. So most students are working doctors, daily planners with 2 to 3 hours a day, live sessions recorded, and you never fail behind. I've done another course already. This is what I said. Our approach is different. You will solve plenty of questions with this. And as you solve the plenty of questions and get the understanding of that, it will be done. No voice, no sound. Why it is so? Okay, what if I don't pass? Access till you pass, no extra fee, no expiry. We stand behind this completely, and this is a part of our full course feature. Full course feature have this that you have access till pass. So real students results rejoice.
Course, no less, no more. So it is perfect. And I got to understand that just having knowledge is not important for the particular exam. The preparation is different. For every exam.
So basically, now you know the 3-step system, what's the short, high-yield videos, and practice targeted SBAs and EMQs, revise with the focused wide worksheets, and that's how you can do it. So for our students who just want to take the screenshot, you can take out the screenshot of this and you can actually just scan and get yourself enrolled. Part 2 full course and part 2 crash course, whichever is your choice. Full course will have access till you pass, and it also gives you access to these videos in the part 3 also. When you continue part 3 with us, how does this help actually? It helps because you can easily go back and revise the theory from these small topics. You don't have to go through the big PDFs again in the part 3. So that's how it makes easy. Part 2 crash course definitely will have access to the past, but if you have not started and you are still confused what to do, or you have joined any other course and you just want to have the important content from us also, then you are welcome to join the crash course and you can have all those worksheet access and everything now. Okay, so that's something about me and your decision today. Do nothing, join the crash course. Either one, that can be done. Either do nothing, same approach, same results, gets what's tested, hope for the best. 90 days, every day is shrinking. Join the crash course, proven 3-hour system, 13 weeks. Filtered content, decision training, EMQ shots, and tricky SBAs is the new feature which is going to be introduced. Access till you pass. You don't need more hours, you need more clarity. Let this be your last attempt. And this is how you can enroll. And we'll add the link to the description box also. And we'll add the link to the description of this video as well. so that whoever is interested can just contact there. You can also take the screenshot and contact us on the numbers provided. How to access the EMQ shots? They are in a website in the course content. So when you join the course, you have access to the course content on the website. You will find the EMQ shots there only. No sound. Why it is the problem with the sound? I think it's okay from my side. Is it audible now? Is it audible? Your voice is breaking. Please repeat. What do you want me to repeat? So basically, yes, what I was saying till now is that from now onwards, just follow the schedule which we have provided. If you are following the schedule, you are good to go and you can finish all your revisions and the syllabus in the upcoming period. So ask me anything, any questions. If you need to book any guidance call with me, then these are the numbers: info@mrcogcourses.com, and our website is mrcogcourses.com. So you can connect with us at any of these. You can connect with us on the phone numbers. You can connect at the info@mrcogcourses.com or on our website. So batch definitely starts today, right? So if you have not started yet, then this is the best day to start. Yes, ma'am, no audible. Okay, thank you, thank you, thank you. So it's open for all your questions. Anything you guys want to ask, let me know your questions. What are EMQ workshops, ma'am? EMQ workshops is a dedicated 10-hour workshop where we will discuss the EMQs from all the modules, particularly the high yield EMQs, which will be like, which out of which like many of them you will see in the exam as it is. So that's a final revision of the EMQs, and that will be conducted in the first week of the June, and that you will get access to all those full course and crash course students. Yes. Any other questions? Any other questions for me? Anything else you guys want to know? Okay, okay. Any other questions? Okay. If we need 3 revisions of the material, then how to plan? Okay. Then see, whatever schedule I am giving will help you revise 2 times. Okay. If you have to do 1 extra revisions, then you will have to put in 1 more hour daily, and then you can do that as well. When if you are starting now with my schedule for July, you will do 2 revisions at least, right? For some topics, there will be 3 revisions as well. Any mock test planned? Yes. First mock is on 21st April. You will get your first mock. So yes, mock tests are starting. And we will have live sessions to discuss the mocks as well, right? So you will discuss the mocks in live session also. So that is Dr. Ankati. Yes. Dr. Pooja, I hope I answered. Yes. What else? What else? Any more questions for me? Okay. So here we finish this session. Bye bye, medical. Okay. So bye bye. Take care. Some of you are still answering the questions. So that's very good. I know. Yeah, you all are like, yes, everybody wants to answer more and more questions. And that's the way of learning also. So we have plenty of questions. We will cover all recalls from the 2015 till date in the live sessions. We'll discuss all important RCOG concepts, all important questions, and that's how you don't need any extra question banks also. So, okay, ma'am, great, thanks. Thank you, Dr. Ankati. April mock syllabus, that is already mock syllabus is module-wise mocks. And you can see the in your website, the schedule. It has all the dates for the mocks as well as it has dates for the live sessions also. So mock syllabus, that's the module wise. So for every module, whatever things has to be covered, that's there. Yeah, thank you, Dr. Francis. Thank you so much for joining. Yes, you all are so wonderful students. How to specifically target the weak topics. As you do the worksheets, topic-wise worksheets, you will come to know that which topic you are weak. You are getting marks there, right? So when you are getting the marks, you can actually go through that topic again and see what points you are lagging on, and then you can ask us about those questions to clarify your doubts. Go back and do it 2 times, 3 times till you master it. Okay, and if in your feedback, in your previous feedback, if you have seen, there is one complete video of that feedback analysis in my YouTube channel. You can just see that video, feedback part 2. Okay, just type in feedback part 2 and you will get that from my YouTube channel. And just go through that, and that will help you figure out your feedback also, like which topics to be did. And then you can just go and focus on those modules. Okay. Fine. Anything else? Any more questions for me? Okay, so I finished today's session here. Thank you so much, everyone, for joining. Have a nice evening ahead. And next week we will have a very beautiful session of a very recent updated topic. And I would love to see all of you there. So stay tuned, and we will have another topic next week. Okay, bye bye. Take care. Bye.